going to talk about the
This
lovely
amazing machine.
Sylfirm X. Isn't it pretty?
I know. They outdid themselves on the color of this, the blue and the gold
I
and the
know.
black. Yeah, love it.
Love it. Anyways, so we're going to jump into this and kind of, to me, help you understand why, to me, I think this is the best microneedling RF machine on the marketplace. I think people don't realize it. I think people base it off of like trendiness and what's popular. I delve into the science. It's about science for me, and physical results. I actually saw one get done and actually literally saw the face go right away, and with less downtime and less pain. Those are the things that sold me on it, and we'll help you guys understand why. Okay, so let's jump into our PowerPoint. So consumers out there are loving trying to anti-age. That's what we're trying to do.
It's what keeps us in business.
As we can see, excess skin and fat in this under chin neck area. 73% of our patient population is looking for that. Then another 71% also look for skin texture, discoloration. We hear that all the time.
We're in California, so we have a lot of patients that have dyschromia.
Yes.
And we'll explain later, but we've not found a device that really helps with this.
Yes.
So
yeah. Lines and wrinkles, around the eyes. I think that is a huge one because ultimately it's the thinnest skin on the body. And what can we really do?
Yeah.
The only things that we would have to do before were CO2 lasers, which literally just wipe it out. Now you can get and do microneedling RF, and you can really start to change that collagen nature because we can go on this machine 0.3 millimeters. So you are very safe doing it on the eyelids if you want to. And that's cool because everything ages. And a lot of people forget when they put sunscreen on. Like I put sunscreen on, they don't actually put it on the eyes.
Right.
I watched a video about that and they're like, the sunscreen is on and the UVA is still hitting here. And so your patient's eye skin is really, really thin and it really does age. And this is going to help patients no matter what. You have to realize, I tell patients, you need to do stuff for skin because at the end of the day, whether you do surgery or whether you don't do surgery, when you start to thicken up that skin quality and that collagen, you're going to make your plastic surgeon much happier because your skin quality is better. If you have frail, crappy skin, when they're trying to sew it back up, it's not going to look very good.
And another point of that is if patients have really thin skin and you want to do threads on them, they will actually kind of just gather. They kind of bunch up like tissue paper. And it's really important to increase that dermal thickness and increase the collagen production, maybe before you even do some threads. So you have to think about what you're doing and what needs to go first and where the patient's going to get the best result while you're kind of regenerating them in a way.
Exactly. All right. So we're going to keep jumping in because we have a lot to go.
Yeah.
Facial harmony, lifting, reviving, renewing, restoring, blah, blah, blah. We're going to go into this is more important, understanding this. And with that 300 micron depth, 0.3 millimeters, that is super cool. The other cool thing is the pulse wave technology. So all the other companies out there for microneedling RFs only have continuous wave. It's one continuous wave of energy being put into this. What happened with Sylfirm X is Dr. Na created it with a pulse wave so you can actually pulse it so you're not overheating the tissue. I know a lot of people are scared with melasma patients and stuff like that. We actually treat melasma with this, which is amazing.
That's so counterintuitive, but we'll explain that later. Yeah.
All right, awesome. So Dr. Na, honestly, inventor, super educated, brilliant guy.
Brilliant,
I could sit there and listen to him explain all this. Honestly, he is considered the godfather of like microneedling RF because he really, really delved into it and really, really understood what is needed out of a microneedling radio frequency machine. Okay, so what is Sylfirm X? Of course, you guys have to realize there's actually a lot of evidence base. There's a lot of clinical evidence that they have done to document why their pulse wave work, why their continuous wave work, how the Na effect is amazing as far as the coagulation ability and not overly damaging the tissue, which is key to having less downtime and more effective results.
We have seen a lot of devices out there that go too deep and take fat away and thin down the face, and it's over treating it. So we want our steak rare. We don't want it well done, right?
Well, not rare, medium rare.
Medium rare. But we don't
Medium
want
rare.
we don't want to damage tissue we don't need to damage.
Right.
So this device is paramount. I mean, it's set up, and Dr. Na has developed this and patented this,
Yep.
and brilliant the way that it can be treated.
Exactly. So bipolar microneedling radiofrequency is what this is, developed by Dr. Na. They had their patented non-insulated tip that allows for the Na effect. So you're able with one pulse to actually treat epidermis, basement membrane, dermis. You can treat all layers of the skin. And because they have that you can do it just in the surface, you can actually repair that basement membrane, which is going to be super important when we're talking about melasma and telangiectasias and all those type of things. So let's jump in. So Dr. Na actually is one of the cool things is he actually started researching all of this based off of just microneedling.
Yeah.
So if you look at that ultrasound, it's 28.3% increase in skin thickness just from microneedling. And when he was doing his research, he realized microneedling has a huge benefit when used properly. Shows a lot of neocollagenesis, and then he started to expand upon
Throw some
that.
heat in there.
And why not take bipolar microneedling or bipolar RF and combine it? I know I do thermages, and I love the radiofrequency technology. However, I could not get it deep enough sometimes to really get the super deeper tissue tightening that's needed. It's from the outside surface. Now you've combined microneedling with radiofrequency. What better way?
And what's different with this technology is usually when you have bipolar needles, it goes from a positive to a negative. So the heat is going from one needle to the other. This doesn't. It goes down each needle itself.
Yes.
So it's very different. So you're not damaging a lot of tissue that you don't need to damage, which is awesome.
Super important. Okay, so this is where I mean, when I saw this, I was like really impressed with this. This is a high digital video camera. We're going to play this, and we're going to stop it at 30 seconds and show you this is the amount of time on tissue that the needles are going in and putting in. So let's play it if we can.
We'll stop it at 0.3.
So you can see the coagulation starting to take effect. It's heating.
Straight down the needles, not in between the needles, which is really important. At 0.3.
And right there, stop.
Yep.
Oops.
Almost.
Oops.
So at 0.3 is pretty much we've got the premium treatment right there.
Right.
We have the least amount of damage. We have the best amount of treatment, the best amount of heat instilled in the tissue to create that heat shock protein, to create the collagen and elastin.
So right there at 30. Oops.
Sorry, guys.
We'll
kind of saw it twice.
Keep playing through the whole thing. We won't stop it.
So this is where the Sylfirm is.
So Sylfirm stops at their continuous wave CW4, stops at 30.3 seconds, 300 milliseconds. And you can see as you get beyond that, your Infinies, your Genesis, your Morpheuses right now, you're creating so much damage to the tissue. Yeah, you're going to get tissue tightening, but do you need to have a well-done steak?
No.
You don't. You just need to create that coagulation around that needle to get the effect that you're looking for.
You've got the efficacy in the 0.3.
Yes. Once you get to the deeper ones, I mean, this is getting now into, profound, which is 3 seconds, 5 seconds, I think it was. You're kind of over frying the tissue. Yeah, you can do that, but what's going to happen as a sequelae? Potentially a lot more adverse events.
Right.
You're going to, for some patients, it will work okay for. Some patients, it will work not great for. Some patients, you get adverse events. And this is why you get this inconsistency. As well, what I remember talking to Dr. Na is the radio frequency that comes out of this machine is actually a very continuous sine wave, which is what radio frequency is. It's not the erratic sine wave of radio frequency that majority of those machines out there have, and therefore we have inconsistent pulses. And I've seen it and heard it where you do one side at the same level and then you do the other side, and for some reason it fries the tissue, and you're just like, I didn't change the setting. What happened? Well, that is probably the erratic nature of your RF device, that they're not putting out consistent, exact pulses that are exactly the same amplitude and the same signal.
And what we want is reproducibility. We want something that we can count on the outcome every time we do it. So it's super important that we have this.
Very important. I love this. Everyone goes, oh, non-insulated, you're going to heat up too much versus the insulated. Well, if you actually see the non effect, because we don't need to go beyond 300 milliseconds, you really, really are creating that nice coagulation from top to bottom, but not enough to damage the superficial layer of the tissue, which is where you are going to get the adverse events that you're seeing on it. I think a lot of people get adverse events because they're moving the needles too fast, and so the pulse actually hits into the epidermis.
Absolutely.
Right? But you can see that nice coagulation, and because you're getting the coagulation, that means no bleeding.
Yes.
No bleeding means no real downtime, which means you're not creating such deep dermal damage. You're creating this perfect amount.
You're creating little channels,
which allows our exosomes to penetrate.
We'll go to exosomes, but you're creating channels. It's not like a needle and it closes up, or there's blood that blocks off the channel. These are coagulated channels, which is something that's huge. Yeah, it's huge.
Get these nice open channels that you can now put product into it. Yeah. You can see from the insulated tips what happens. They focus the energy because they have to force it down into that little bit. And as you get deeper and deeper, you're not getting the coagulation through the whole thing. And the fact of the matter is, you only work on that one level. So if you chose to go at that 3 millimeter level, now you have to come back and do a 1.5 millimeter. And then you have to do a more superficial.
Which I've done on other machines. You're doing multiple layers at different depths. Yep. So with this, you're treating it all within one.
It's all in one, and it makes your treatment times faster, more comfortable, because you're not going, oh, let me do one layer deep, let me do another layer because I need to do the second layer, and then we do the third layer. Literally, I'm done in half the time, and my patients are, it still hurts. I mean, it's RF underneath, but it's going to be less painful because you're not creating this whole necrotic tissue underneath. And so that saves you time. And honestly, doing these things, it does take time. I sometimes fallen asleep trying to do it. But ultimately, when you're doing this and you can just do one pass, maybe a second pass over the areas that have not tissue tightened, it makes it so much better.
Yeah. And you're really crossing over. You're really kind of doubling. You're not doing a square. You're kind of a little overlapping.
Yes, a little overlap definitely does a beautiful, beautiful job. But this is why, to me, this separates it out. The non-insulation, the RF, the amount of the continuous wave that is really creating this non-effect, this coagulation. We're not overly cooking our tissue. Yeah. Like not having, you want a good state, medium rare,
right? And you want it the same thing every time.
Yes, exactly.
So you can reproduce this, which is amazing.
Okay. So the other cool thing about this is the pulse wave mode. Very, very, this is the only microneedling RF machine out there that has this technology. It's a pulse wave. So it's taking that continuous wave, breaking it into multiple waves of energy so that you're not creating so much inducing heat, which is, you're still going to get some tissue tightening. So for those of my patients that are scared of melasma making it worse, we use the pulse wave. You're going to be able to treat that layer of tissue, but also do some tightening. Maybe not as much as the continuous wave, but you're still going to get tissue tightening by doing the pulse wave.
And with the Q switch, you're going to really be able to help with the dyschromia.
And that's where you actually can use the microneedling RFs with your other lasers at the same time.
Yes, you can.
In that sense.
We have Q switches.
Right? So, this is going to be able to address both deeper and superficial. One of the important things that Dr. Na taught me was really with melasma is repairing the basement membrane.
Yes.
The dermal epidermal junction is important when you have especially melasma patients, because once that breaks down, you really, really see the melanocytes travel down into the dermis. They get sporadic, and that's why you have this recurrence of melasma. You can treat melasma, get it out of the tissue by breaking it apart. But if you have not treated where the melanocytes are, which is deep down, and because that basement membrane is open, Now, by going back in, taking the pulse wave, you're going to repair that basement membrane. And then when you clear the skin up of the pigmentation, you're not going to get recurrence of your melasma.
Yeah, and help get rid of the senescent cells that are in the top layer.
Exactly.
Absolutely.
So as we said, continuous wave, different depths, 0.3 all the way to 4 millimeters. 4 millimeters killing fat probably by that time if you need to go that deep for those patients. Well, you know, the jowls, if you need to get under here.
Well, you can. If that's your goal, you have to know where that dermis stops,
right,
and where the adipose tissue starts, because you can, if you want to hit fat, hit fat.
Yeah.
If you don't, please don't
and
go
that's
that
the
deep.
biggest thing.
Yeah.
Understand what tissue layer you are focusing on when you're doing these things. You know, any microneedling RF, I think I hear too often, oh, I can go so deep. Like, why?
Yeah.
Is the skin that thick? No, go back to your anatomy of the skin. Okay.
The other thing, this might sound confusing to you guys. Okay. I want to let you know that this machine comes with the easiest instructions in the whole world.
Dr. Na has his cheat sheet.
You just look at the cheat sheet and you're set. I just want to let you know.
All right. As you can see, continuous wave, improvements in wrinkle quality, improvements in tissue tightening, and I actually see tissue tightening kind of almost right away. We've actually done it on her.
We should show the pictures, like one side.
I wish
like,
I had to go back and look for it, but we had a picture of her where we did one side and one side immediately brows and the whole thing just shrank. Like you literally shrink wrap. And I tell patients we need to do the shrink wrap. So as much as you're doing the thread, you're repositioning the tissue. Great. You're doing a good job of lifting that heavy tissue. But if you don't do something for the skin and shrink wrap that, you're still not hitting it on the mark, really getting that 100% anti-aging effect that we're really, really looking for. So combining the two is great. Maybe doing it a month apart, I think, is a great thing. Letting the tissue relax from either one before doing it again. So give it about 4 weeks in between your treatments if you're going
and the patients are going to like the result, but they're going to like it better 3 to 6 months later. Because all we're doing is putting holes in there and heat, and we're inducing collagen production and elastin production. We're stepping back. It's all up to the patient, and the body heals and makes these things very slowly. So let it have time. Let the education's paramount. Let the patient know you're going to look better in 6 months than you do today after your third one, and they will, because they will get continuous collagen remodeling. It's awesome. Yeah.
All right. So the pulse wave. Let's talk about that.
Okay.
The microneedling, it's a short pulse width, and therefore you can even take it and only go into that 300 micron. I mean, you can literally work right at that epidermal dermal junction, which is that basement membrane, which is what breaks down as we age. And that some people break down more, and therefore they end up with melasma, and maybe hormones change that basement membrane. We don't know. We're still learning about that. But theory-wise, from Dr. Na, the dermatologist from Korea, is that once you repair that dermal epidermal junction, you really address the whole issue with regards to why melasma does not go away. Melasma the melanocytes travel into different layers, and therefore you can get rid of the pigmentation that they create. But if the cells themselves are not back up in that epidermal dermal junction, you're still going to have issues. Texture tone, you can see telangiectasias. I've seen the redness start to disappear on patients. So really, really, really cool thing. You can focus this on patients you're afraid of for melasma, because you can actually treat the melasma. It's not going to take away the pigment in the skin. This is where you can combine it with a Q switch, so you take it away. But this is about repairing that in that layer. Okay. You know, this is the patented delivery system, gentle, minimal discomfort, reduced downtime, 25 pins. They have a new tip coming out, which is supposed to be even cooler. So we'll wait for that. I'm excited for that to come out. But this is some of the studies. So the senescent fibroblasts, as we age, are starting to come up, and really, really, that creates damage in your skin, because they're dying, they're aging, they're not the young fibroblastic activity.
It's just a bunch of muck in the extracellular matrix. It's just a bunch of debris. So if we can get rid of that debris and clear it, then we can produce collagen.
And your skin's going to look healthier. It's going to have a better glow. All the things that we talk about, you know, when you're doing biostimulation, all that stuff, this is getting in there, repairing it. Look at the melanogenesis, the bottom one. The repair of that basement membrane is what we're all about. We're trying to repair that basement membrane so that you don't get it to drop underneath, and melanocytes travel into different layers and create pigmentation all throughout. And that's what's happening with the pulse wave. You're able to focus in on that aspect of it. And the fact that you can dial this down to 300 microns. Majority, actually, probably all of the other RF machines can't do that. You can't dial it down to 0.3 millimeters, which is where we're trying to focus on the dermal epidermal junction. So I just saw a question from Marina, Genus RF versus Sylfirm. Unfortunately, there's no comparison. And that's why, I mean, I have Virtue Vivaces at my clinics. Going forward, most of all the new clinics are getting this, and if I can afford to replace the older ones, they definitely will be. But you know, when you understand the technology and what this is, we don't need to fry the skin. I think we've been focused on the more power, the deeper is where we're going, more milliseconds of energy into it. You end up frying the skin, and then you end up going, okay, yeah, I'm waiting, and finally, as it repairs itself, 2 months later, you're like, oh, okay, I see the tissue tightening. Yeah, you're going to get tissue tightening from other RF microneedling devices, but what you're going to get is you're going to get a refinement of it. Your patient's going to be much more tolerable to the treatment. You have a lot less adverse events with regards to it. And the fact that this does have the pulse wave, which focuses on that dermal epidermal junction, and you can see really about that repair right here. This is one of the histological studies that they did, and that repair of that basement membrane. If you have damage in that basement membrane, you're going to accelerate the aging process. And this is where pigmentation comes up as we age. You know, you start to see all this brown photo aging and all that stuff. You start to repair all of that. You get that dermal epidermal junction repaired. The collagen's much thicker and healthier. You're going to have beautiful skin. And that's what we see every day.
Yeah. So this is clearing out that debris. Yeah. We want to get that debris in the extracellular matrix out of there and allow the collagen and fibroblasts to do their job.
Yep.
And stimulate. We stopped making collagen at 25 years old, you guys, and we stopped making elastin at 18. It kind of sucks. So if we can stimulate that by clearing out the extracellular matrix, helping the fibroblasts make new collagen, this is perfect. And this is the newest technology. So we're always going to see new technology come out of there. And we see that more isn't necessarily better. We're learning that with this
more is not better. It's kind of like you need to work out 5 hours at a time. If you focus it into doing what you need to do, you can do a very focused workout in an hour. This is kind of doing that. You're focusing on what needs to be done and not overshooting it and creating this whole mess in the tissue that your body has to try to figure out how to repair it, thereby getting better results, because you're really focused on coagulating right in that area without creating a necrotic event underneath.
Right. And I love this slide because this really shows you the right one is blown up. And the left one is, I think, just like 4 times. But the right one is blown up, and it shows you that there is a channel that is actually a little necrotic channel, tiny little channel, but it is sealed.
Yep.
So you have an opening that goes down into that dermal tissue.
This is the other one, is all this debris and blood coming up. And so, you know, if you're not getting coagulation, you're getting a lot of bleeding with your microneedling RF,
you're not going to get things
you're
down
going
into
to
that
not
little
coagulate properly. You're coagulating right at the bottom because it's an insulated tip, and you're doing one level instead of have a whole channel. Remember, you know, just because you're getting your RF and poking holes does not mean you're going to be able to penetrate products. Because this is a non-insulated tip, you get from epidermis down through the dermis a nice channel, so your product actually penetrates down into that. When you're doing multiple different levels, you know, 3, 1 and 2, 1.5, you're actually just focusing on those levels, and you punched a hole in it. You have blood going in there. You have not sealed it. It's erratic. Your product's not going to get in deep. And when you're using a beautiful product like an exosome product that we'll talk about later, you want it to get in there, because this is what we're all about.
We want to fertilize.
We want to fertilize.
I would say microneedling is like aerating the lawn. Now the exosomes are dumping fertilizer in those.
Those exosomes are going to take it level. We'll talk about that in the next lecture. But exosomes next level versus PRP. I use most of the exosomes now.
So do I.
All right. Clinical evidence. There's actually 26 published articles on this machine. pulse wave versus continuous wave, and the imaginations of what you can do from the senescence to the dermal epidermal junction, repairing that, to the gnaw effect and what the beautiful results that you're getting from the gnaw effects are. Okay, so you can see improvements of acne scars with one treatment.
This is one treatment, you guys. This is really good.
You know, skin texture, tone.
And it can even out the overall
Look
tone.
at this one.
Yeah.
The eye.
Eyelids. We've never been able to do eyelids before.
Eyelids. This is great because you can get really light. You can get into that 0.3 millimeter. Probably I would say 0.5 millimeters is nice for the skin on the eyelids. But I tell my patients, even if you're going to consider plastic surgery, you want the head skin to be the healthiest it is. So this is not going to detract from it. You're actually going to help yourself and help yourself heal with less scarring, less issues, because your skin is healthier going into the surgery. So don't be afraid of talking to your patients who are going to get facelifts, who are going to get blepharoplasties. They need to do this, because when this plastic surgeon pulls it apart and the skin frays on them, you're going to have a hell of a time repairing the tissue. That suture isn't going to pull in as nicely, and you're going to not heal up as well. So if you have thicker quality skin, better collagen, you're going to heal up better from any type of surgery.
And if you think about it, babies have thick skin. They have a thick dermis. We age and it thins, and that's why we get our wrinkles. So if we can thicken our dermis, we are going to have less small wrinkles. We're going to have less lateral cheek rhytids. We're going to have less small wrinkles.
Yep. Texture, skin tone is better.
Look at that neck. Hello. Can I be a model?
Right. Dr. Sheila Curry did an amazing job here.
And keep in mind, there's a special on Sylfirm also. So
you guys got to get the machine.
So there's a special on it also. And today only. Yeah, there's a special also. So you guys
look at that
put
lifting of that lower face area. That tightening aspect of it. It's so good.
Yep. This is crazy.
And you can do
1 week after.
You can do body parts.
Yeah.
That's the beautiful nature. Elbows, knees, tummies. Lax skin is everywhere. So you guys need to treat everywhere. Look at that texture, the glow. Beautiful. Treatment parameters for melasma, it's currently under FDA indication. So look out for that. They will get it.
Yep.
This is using the pulse wave, because you're repairing that dermal epidermal junction. So while there's a special, jump on it, because you don't want to be the last to get this. You want to be the first to be getting this treatment out to your patients. But look at that. This is a melasma clinical study. And this is combining laser toning. So the Q-switch ND-YAG is what we do. We typically use that to break up the melanocyte or the melanin in the tissue. And you can see you do the microneedling RF first, and then you follow up with Q-switch. You can do it at the same time. And you can see, honestly, between the monotherapy, where it's just the Q-switch ND-YAG laser versus Q-switch ND-YAG with your microneedling RF, you can see there's a better quality of skin. The pigmentation starting to go down, much improved on that aspect of it. So more studies, you can definitely see the improvement in the quality, the skin, just the actual epidermis, dermis, all of that collagen just looks so much healthier in that aspect of it.
This is beautiful. So if you, all in all, don't be afraid to use a non-insulated needle with dyschromia, with melasma, because you're going very superficial. You're using a pulse wave and you're repairing that basement membrane. And then we can break it up. We can break up that pigment with the Q-switch, break it up, and then the macrophages absorb it and take it away. So it's like we're fracturing it.
So the microneedling RF isn't really getting rid of the melasma immediately.
A good environment.
It's creating the future placement. You have a better foundation, so you don't have this recurrence of it. You still need the other stuff, whether it's chemical peels or lasers, to actually take out the current pigmentation that's been left all over the place. But ultimately, this is about creating the better environment for the future, the better skin quality, and it does not really return. You know, and that's the important thing. Of course, aging will continue to break it down. So that's why you're going to continue doing these on your patients forever.
And two, patient education is paramount, because extrinsic factors such as sun and heat will exacerbate melasma. So we have to educate our patients too.
All right. Redness. telangiectasias, melasma, a big component of it is is a redness. We know that now. There's a vascular component to melasma. So if you're able to actually work on repairing the dermal epidermal junction, but also getting rid of the vascularity because you're focused on that vascular, that I don't know. It's just that fine reticulated type of
almost like
redness.
little microcapillaries.
You can get rid of that using this because you're focused in that level.
Yeah, the majority of melasma has a capillary or a vascular component to it. So if we can reduce the vascular component, we're going to reduce the melasma production, if that makes sense. So hitting both the vascularity and the pigment is paramount in helping to really reduce the severity and recurrence of it, along with teaching the patient to stay out of the sun.
And look at this. You can actually even treat
hypopigmentation. We have never had something that's treated hypopigmentation ever. We've always told patients put makeup over it. We've never had this work. So
this goes back to repairing that dermal epidermal junction.
Absolutely.
When you repair that, the melanocytes start to creep back in because there's a healthy foundation to your skin, and your body will do its job. You just have to give it the right stuff.
It's crazy. This is groundbreaking.
Yes, I think it is. For your patients who have hypopigmentation, maybe caused by laser, caused by trauma. In this case, right here, this was caused by laser hair removal burns.
That's traumatic.
That was traumatic, and you can see with 1 or 2 treatments, you're already repigmenting that area back up. And so, definitely super cool that you can now have an option to actually treat hypopigmentation. It takes treatments because you need to repair that dermal epidermal junction, but there is hope.
Yes, that's groundbreaking.
I think it's super cool.
Yeah,
that we can do other things. So minimally invasive, really minimal downtime. I mean, most of my patients probably, and I get it done now. I'm red for
not very long,
like 30 minutes. Once we put the exosomes on, which decreases that and starts better collagen production. You literally are minimally pink, minimally swollen the next day. I mean, it's not even comfortable enough compared to other RF machines that I've tried. Definitely much more comfortable.
And there's
but
always
still,
Pronox.
There's Pronox. I inhale that for sure. I don't want to feel anything. I'm a guy. We feel nothing.
Just do it while they're drunk. It's okay.
So as you see, skin revitalization, improvement in skin texture, tone, pore size, scars, all of that stuff.
And it's repeatable, it's reproducible, it's safer, it's less adverse events. So there's a lot to this newer technology that that has been learned from other technologies.
Yeah. So, I mean, this is the evolution. I mean, that's what it's all about. We're not damaging it so much. We're doing a controlled damage, which is what we're always talking about with lasers. It's about controlled damage, so you get the right amount of healing. If you overshoot it, you're gonna maybe get good results in the future, but you may have potentially a lot more adverse events going on with part of the repair process. And this focuses the energy right where we want it to be.
Now we're gonna show you how we do this.
Oops. Yep, we're gonna go into live demo. So give us a few minutes while we transfer over, and we're gonna start a microneedling RF. Alrighty,
we are back.
Hello.
I wanted to show you this. The tips come in a box like this, and there's a box of 10 tips in there. So each one's got a little gold cover on it. Yep.
And you definitely need to put it on with the gold cover. Don't take the tip off. Otherwise, the needle, you're not going to screw it in at all. So I actually keep the tip around just even throughout the whole treatment, just to put it back on if I need to screw it off and on and stuff like that. So when you're putting on, there is a red dot or red area that connects together. If I can put it.
And just match them up.
You match them up. There we go. Match them up, and then you twist. And there we go. So you just match up.
It's like a game.
Then you can pull off.
There you go.
Then I keep it off to the side. I don't dump that just in case. Okay, so this actually, if you guys can see, is simple. This is literally your settings up in here. This is what we're going to adjust. Pretty much the cool part about it is it has continuous wave 1, 2, 3, 4, pulse wave 1, 2, 3, 4. So nice clinical settings on their own if you take a look at that. And then intervals is how quickly they pulses. The quicker you are, boom, boom, boom. This is going to be your depth that you choose, and then this is your energy level. Okay, so the deepest one, this continuous wave 4, is going to produce with 300 milliseconds, so 0.3 seconds of energy, and as you go down, it's less by 0.04, so 0.3, 0.26, 0.22, and everything like that. Okay, is that better for you guys? No, I think it's better like this. All right, you guys can see it. So I'm going to choose for her because she actually, if we look at the patient, she actually has a little bit of melasma on her. She has even some little hypopigmentation into this area. So I'm going to just do a continuous wave 2 right in here, and then probably just do a pulse wave 2 through here, added on top of that. But we're going to try and tissue tighten her. She has a lot of laxity kind of through this area. Sorry, Christine.
Don't listen.
Don't listen to me. And then we're going to take it all the way. And the cool thing is we can take it all the way into the scalp. Remember, the scalp does age. And so we want this texture right in here. You can see how loose this is. You can see how much give she has through this area. And so what I'm going to do is I'm going to adjust it. I'm going to do a continuous wave 2. I'm going to change it to automatic pulse. I'm going to change my interval setting down to a 0.03. Depth, we're going to go, and I'm not going to do too deep on her. Her skin isn't super thing. I'm going to just do 1.2. Power does not need to be that high. I'm going to do probably a level 5 or 6. I'll probably do a 6. No, we'll do a 5 because she has a little bit melasma. You push ready, and now we're ready to go. And you can see, literally is easy. I just keep my foot on the pedal, and it goes. You want to see right here? Up above, 1, 2, 3. So the light goes on every time it goes in and shuts off. So you want to move it when the light goes off. Okay? So we're going to do this. One of the things what I learned from Dr. Na is actually a vectoring technique. So we're going to take her into 3 different vectors. One is going to go up, one is going to go lateral, and one is going to go up. So kind of like a triangle is what we're going to do. So we're going to come in here, and we're going to go, and I'm going to pull her skin up towards her scalp the way I want her face to go back up. So 1, 2, 3. You can see how easy this. What do you think, Christine? How is it?
Can't feel it.
Yeah, she's pretty darn good. And you can see with every pulse that I'm doing, I'm waiting for the light to turn off before I move it. And I'm doing about a 30 to 40% overlap. Okay, and I'm holding her skin upwards in the vectoring that I want it to be. And you can see there is no bleeding whatsoever. This is the cool part about it. If you guys have questions, yes, this does get boring after a while.
It's boring until you see the one side and you're like, what?
Oh, I know. We did yours. I was like, holy
Like, oh my gosh.
smokes.
Holy cow. Can I do this every day?
I need this every day.
So Pamela's asking, what do you charge a patient for radiofrequency treatments for the face or face and neck? So how do you charge your patients? And I'll tell you how I charge mine.
I charge them per treatment. If they do as a package, I will give them a discount. I typically sell as package of 3 or 5, depending on how aggressive they need to be worked on based off what I see as far as evaluation. You can see right on the bone, the zygoma gets a little bit more sticky. Areas where they're more vascular, they may bleed a tiny little bit, but you can see overall how comfortable it is. The coagulation that's happening around the whole needle itself, creating that gnaw effect. So I would probably say I charge somewhere around, for me to do it, about $1,200 for face, and then like $1,800 for face and neck. It's kind of what I charge.
And you can use the same tip for face and neck.
Yes.
So you don't have that consumable again to use.
I mean, you can do body at the same time. It just comes down to your time, your effort that you want to have on the patient.
And this is something that's delegable. So you can delegate this to nurses, depends on what state you're in. So sometimes estheticians can do this depending on the state that you live in. So this is something that if they're trained, it's reproducible, it's safe, and you can really delegate this to other staff if you want to.
I mean,
you can charge $3,000 if someone wants you.
True, I should.
So Sherry is saying, can you get broken capillaries or bruises? What's interesting about this is generally not, because this is a it's a non-insulated needle. So it's going down and it's coagulating as it's going down into the tissue. So you aren't going to get bleeding generally with this because it is stopping any of that bleeding. And if you have telangiectasias or small capillaries, it's going to close those off. It's going to help to actually reduce those.
Yes. So I'm vectored. I vectored in the
Good question,
upward
Sherry.
diagonal. Then I did along her jawline and pulled it back. Now I'm pulling her upwards from this gonial angle area.
So Sherry has another question. How dark of skin, like, can you do to still get tightening if they have melasma?
I mean, I would probably say you can do all. You just may need to break it up into smaller sessions, not put so much heat. You can end up doing like pulse wave over the whole face and do that. But I mean, I think you can gear it towards what they have. If it's melasma, repair the melasma, repair that basement membrane. You can always come back and do more aggressive tightening once the melasma starts to clear up, right? You don't need to do it all at one time. The pulse wave in and of itself will get you some good tightening, just not as strong as this in that sense. And take a look at that. You guys have, look at that vectoring. Nope, go from up above. Look at that. Compare this.
Yeah.
That's already tissue tightening.
Right away you see it.
To lift her. Okay. So now I'm going to go up and finish her off a little bit up in here in the brow and the scalp area. So I'm going to change it up. We're going to go continuous wave 1. I'm going to take it to 0.8. We're going to go power. I'm going to drop it down to 6.
Janice asking if we put numbing on. Yes, we put BLT on her, and I use it. I have a 23/7 at my clinic, so we put it on and left it on for about a half hour, let it soak in, and it works really, really well for comfort.
Yep. So I do take it into
This
the
is
scalp.
The spicy part, though.
Lori knows.
This is where I sucked on the Pronox, was my scalp. You're doing good, girl.
How do you feel overall?
It's not bad.
It's not bad. It's a little spicy up in here.
Yeah, but not terrible.
Okay, I'm just a wuss. I'm just a wuss.
You are.
I'm a wuss.
It's okay. But you definitely want to treat the scalp in this area. And it's great because if you're using your exosomes or your PRPs, now you have a channel for them to go into.
So, question from Marina. On a Fitzpatrick 5 or 6, is this still safe? And what parameters would be the safest on high Fitzpatrick?
I mean, you can definitely put it at a continuous wave 1, continuous 2 is probably where you would be because you want a little less of the milliseconds. So time on tissue is a little bit lighter, but you're going to get really nice results. I mean, you can see we just did continuous wave 2 on her. Normally for her skin type, I probably may have even pushed her to 3, but because of her melasma, I didn't want to push it so significantly into the area.
And you could have patients on pigment inhibitors, you know, things that are non-hydroquinone based or hydroquinone based. Yeah. With this, honestly, it's fine.
You don't even need it.
It's fine. You can, but I mean, a lot of our patients use it continually.
Yeah.
You know, California, sun, all that fun stuff.
But yeah, just in general, you can do all Fitzpatrick scale here.
As far as pre-prepping the skin, the one thing that I do use is I prep my patient's skin with elastin nectar, and this is not a commercial, but I like to clear out a lot of that debris from the extracellular matrix so that it allows more of that collagen to form. And the pulse wave does the same thing. So it's kind of a double whammy with helping the production of fibroblasts and collagen. So I prep my patients when I do treatments like this or CO2 with the elastin nectar because it helps give a really nice result.
It's not as movable as before. It's tighter. Her tissue is actually much tighter, not as friable as it was before. It does not have as much give as it had before. I'm going to finish off a little bit up here.
And what's kind of counterintuitive is you would think that these needles with the heat, you would have a lot more downtime than, say, regular microneedling. And you don't. The pinkness stays for, 20 minutes? I mean, not really long. It goes away. They can put their makeup on. They can do whatever they want to do within 24 hours because these channels will generally be closed up within about 24 hours. So they can put their makeup on the next day that will hide any little bumps or anything that might have, depending on their sensitivity.
I mean, look at that. Can you guys look from here? It's hard to tell over there, but I'm looking from her from this angle down, and I can see that I've actually really done a little bit of lateral lifting to the eyebrow compared to the other side. Her eyebrow is sitting a little bit higher on the side from working through the scalp, and you can definitely see, look at that. Nice contouring versus this side. You can kind of see it's actually helped down through here, and we haven't even started working on her under chin area. So you can definitely see the tissue tightening, slimming effect of the face kind of immediately.
John Lee is asking, do you get better results by covering the whole face instead of a vectoring pattern?
I would probably say the vectoring pattern. I mean, I'm covering the whole face, but I'm vectoring it in a certain way. I'm not just pushing in here. You still will get good results because I know there are a lot of people who have the Sylfirm that didn't get trained by Dr. Na, and they're getting some amazing, amazing results without doing the vectoring pattern. This just is that little extra cherry on top that literally, when you do it in this vectoring, follow through into the scalp, you just get this like tissue tightening aspect of it.
And when the inventor tells you to do it, you're like, okay, I'll do it.
You definitely do it.
Like, okay, I'll do it because you're way smarter than me.
I'm going to get a little bit more aggressive on her under chin area. You can do continuous by 4 or 3. I'm going to take it to,
Mark Chenoweth is asking, can you turn the RF off altogether to treat the scalp like a standard microneedling?
Yep.
It's a good question.
You can totally do that.
And then we throw a little fertilizer into those aerated holes.
Yeah, you could totally do that.
Absolutely. Throw the exosomes in there.
Yep, for sure. Okay, we're going to do under chin. Stick it all over.
Now, she has some hypopigmentation also. So she's got a little hypermelasma, and she's got some areas of hypopigmentation. So with the pulse wave, this is going to help, like we've been talking about, that basement membrane is going to help repair that basement membrane and help to kind of re-stimulate some melanocytes in that area to make it healthier, to even out some of that hypopigmentation.
So I'm taking this a little bit deeper because we want this to tuck in a little bit deeper.
So Sherry is asking, can we do this first, then immediately place lifting threads, then apply exosomes and or inject? I have a tendency to do one thing at a time. So if we're doing this, I know you do lots of stuff, so I'll let you answer afterwards, Mr. Cowboy. I have a tendency, so you get a little bit swollen with this, a little bit, because there's heat in there. And I want to see tissue exactly how it is, where it sits when I'm doing threads and or fillers. So I would kind of recommend either doing your threads. You could do this maybe the week before, and then let it just calm down, and then do your threads or your fillers, or vice versa. What would you like to do? You do them all at once, don't you?
No, actually, because I want this heat to really focus on that, I probably will wait as well. Yeah. If they were really like from out of town and blah, 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 would I do it? Would I push it? Yeah, I probably would for those. But if they are around, I probably would tell them to relax it out. You just don't want to traumatize so much into the area. And so I would probably wait a little bit. Take it down on her neck area.
So say somebody has a little fuller neck with some adipose tissue here.
You can go a little bit deeper and kill off some of the fat, but you just have to be careful. You just have to be a little bit careful on the aspect of it. Okay, here we go. 1, 2, 3. Let's see. Am I doing less threads now because of the Sylfirm? No.
Think of the Sylfirm as dermal thickening. And a little bit of tightening, but not as much as threads would do. So you're going to increase the skin's integrity and give you more elasticity and collagen superficially in the skin, which is going to give you a little bit of skin tightening, but it's not going to lift the fat pads back into position. It's not going to reposition a lot of deeper tissue.
Yeah. So threads are definitely done. And I actually, depending on where your patients are they afraid of threads? Do they need to think about it? I say, okay, then we'll start with this microneedling RF first. And then when they're comfortable, we'll do the threads. Remember, you're working on 2 different levels. Threads are going to work on that superficial fat pad layer to actually reposition the fat pad. This is going to work on that dermal epidermis to actually tighten the skin. So it's the Spanx, I call it.
Yeah.
I call it, when you're young, your skin is like a Spanx. It holds everything together, hides a lot of those fatty tissue. Yeah, you may have a little bit fattier tissue in certain areas, but it looks tight and firm. As we age, the Spanx loosens up, and you got to do something to reinvigorate the tightness. Can it go? Yeah.
So if we want to help reduce some of the adipose tissue or fat in areas, say a jowl or submental fat, we can go 3.5 to 4 millimeters deep with this. So this will go pretty darn deep. And you don't want to do this all the time, but if you want to hit some of the fat and you want to kind of fry a couple of those little adipose cells, we can do that.
Yeah, we'll do a little bit.
I would love to see a study on poikiloderma with this. I would love to see that. We have a lot of patients with poikiloderma here in California.
Probably could do this a little bit more superficially.
Because I could
pulse wave too.
I could see this happening with the capillary flow and the hyperpigmentation that occurs with it. I think we should get a study going.
You can do all the studies in the
Dr.
world.
Na, you watching? So you see how comfortable the patient is. She's had numbing on for a half hour, but she's not. She's a stud, but she's pretty comfortable, huh? How are you doing? Good. On a scale of 0 to 10, what would you rate the discomfort?
4 or 5. It's not bad.
So medium, like a medium. So I always say spicy. It's little hot needles. You feel little hot needle pokes, right?
Yeah.
But medium. Yeah.
Yeah.
It's very quick.
So we're going to do some quick, just to show you guys again. We're going to do continuous wave 4, which is a little bit more milliseconds. We're going to go a little bit deeper, trying to kill off a little bit of her fatty or tissue right into this area. So we're going to go 3.5 millimeters deep. So 1, 2, 3.
Now, can you see how much further the needle is going into the tissue here? Watch that. Much deeper into the tissue. So it's getting past the dermis and it's getting down into that adipose tissue to heat it up and cause apoptosis in the adipose tissue. So you can kind of reduce layers of fat this way.
Yep. And then, there's a purpose when you're choosing what layer you want to focus on. Right here, we're focusing on fat. So we're trying to kill off the fat. Earlier, we were doing skin and tightening. So we focused a little bit more superficial. Just to show you pulse wave 2, we'll go in and we'll go 0.5 millimeter. 0.4, 0.5 is about the level where the epidermal junction is. We're going to do a power of 4. Do 5. And we're going to work on kind of the pigmentation, melasma aspect of it, repairing that dermal epidermal junction.
So he went first with the continuous wave
to
cut the tightening, and now is the real superficial component that's helping repair that basement membrane to reduce some of the melasma and
if you were
create a more healthy environment.
And if you're going by Dr. Na's protocol, he probably actually would do this separately. He actually likes to do the pulse wave all on one time rather than do continuous wave and pulse wave. He finds that the pulse wave does enough tissue tightening to do that versus doing the continuous wave. So we're just showing you just that we can do it. And I've done it on patients where I do combination, where I go a little bit deeper for the tissue tightening. And then I take it and I work on that dermal epidermal junction. And this one, I'm not really doing any pulling or vectoring. I'm literally just working on the surface because this is only going 0.5 millimeters into the skin, working on that dermal epidermal junction.
And you could do a 30 to 50% overlap on this. It's fine.
I even like doing this around the eyes just because I think it does a beautiful job at the pulse wave. So we can do right here, 1, 2, 3. Okay, a second one, a little bit lower.
And 0.3 millimeters is not going to go through and have any issue with the eye. It's
Yeah.
going to stay in that very, very superficial
You can
component
even
of the
get
skin.
away with 0.8, but probably I like a 0.5.
You would, not me.
Hey, the skin is a little bit thicker.
So Angelica's asking, if you have someone with very thick skin, do you use continuous wave 4 or do you go by Fitzpatrick with very thick skin?
I probably would go with based off of Fitzpatrick.
Yeah, I think the first is, first do no harm. You don't want to, you want to instill too much heat into somebody who's got a high Fitzpatrick.
Yeah, I don't think thick skin really necessarily means that you have to go stronger, because you're already creating your coagulation through that needle itself. So you're already creating this tissue damage. That's all you want. You just don't want to overly damage it. So I would base it off of Fitzpatrick scale. I'm just lightly going over.
Oh, Shannon just got your Sylfirm this week. So yeah, she's kind of agreeing with me that poikiloderma might respond really well. I think it would too. I'd love to see some studies. How about if we make us a study place so we can look at this stuff.
More things on our platter? I don't know.
No, I guess we can. We'll throw it on Melanie Palm's platter. And, yeah.
Not me.
So you guys click on the link that you see to schedule an appointment to redeem the special on the Sylfirm. So you'll see a link on your computers and click on that so you can redeem the special. And this is the newest technology. This is something that has kind of taken the radio frequency world by storm, kind of unexpectedly, but not, because Dr. Na is so darn smart.
The Gen 1 of this is actually named the Scarlet. So if you guys have heard Scarlet, it's been on the industry for a while. It's not newish. His RF technology is not new into the market game. The pulse wave is definitely very new, but the Na effect has been around. He's been studying this for a long time, guys. I consider him kind of like godfather of microneedling radio frequency. He has so many patents with regards to this. You guys have to realize that he's actually dedicated his life to studying microneedling and then RF combining with it. So,
and what you want is the histological pathological slides to verify the results that someone is saying. So don't believe everybody when they just want to sell you a device. Look at it, research it, look at the histology, look at the reports, look at the peer-reviewed research, because that is paramount when you put a lot of money into a product, and you want to make sure your patients are going to get the result that they're paying for. Right. That is more important than anything to me, that these patients are going to be happy with their results and they're going to get the result that they're paying for.
Look at that. Let's see if we can set her up and see. Look at that. Turn a little bit this way.
There you go.
And then turn a little bit this way. Look at that jowl.
Zoom in on her, guys.
You guys see how it's pulled her up, even the eyebrows.
Look at her brow.
And this is what sold me. I was watching Dr. Na do it using his vectoring technique. I mean, look at that.
Her nasolabial folds lighter.
Nasolabial folds lighter. Like this.
The labial mental area is lighter.
It's amazing to me.
Yeah.
And you look at this as well. So, and you can see we just did one level. We didn't have to do multiple different levels. Way less painful than majority of the RF microneedling machines out there. Look
at her brow.
Camera, right? Which camera? Yeah, the center. Cool. I mean, look at the brows. All right, go ahead and lay down.
Love it.
We're going to add on to this is, do we have the exosomes? Let's open one up.
Okie dokie.
And we're going to place it on this area.
I'll let you open that. I'll open this one.
So Mark channel with why are Sylfirm treatments less painful than other RF devices like Morpheus? It has to do with the amount of conduction time. Remember that. Remember that picture we showed you of the amount of tissue damage? Well, Sylfirm stops it at 0.3 milliseconds. Or 0.3 milliseconds. So 300 milliseconds is where it stops. So 0.3 seconds. And so majority of them, like Morpheus and Infinity, Genius, a lot of them are jumping into going almost to closer to 1 second of conduction time. We're at 0.3 versus 0.6 to 0.8 seconds. And so when you add that much heat to that area, that is where it hurts. And then secondly, because of this non-insulated tip, one non-effect versus majority of them, they tell you need to do one level, then come back and do a second level, and then come back to a third level, because you're not tightening on all the levels. That's why you need to do it. It's kind of like Ulthera. If you guys play with Ulthera, you do the 4.5, you do the 3, and you do the 1.5, because you need the tissue tightening, and it's the damage needs to be done at every level for that. This, because it's non-insulated, you get the whole thing done at one time. So it's one poke, one pass. That's it. That's one aspect of it. The second aspect of it is just the fact that even at the highest level, continuous wave 4, you're only doing 0.3 milliseconds of tissue damage.
And it's really controlled, because there's a motor in that handpiece, and it is going at a specific rate in and coming back. It's not like a bounce. It's not like a rubber band. It's very, very controlled, and it's going in very controlled and out very controlled. So you don't need, like we were talking about, you don't need to, if you're gonna have a steak, you don't need to burn it. You don't need it well done.
Nope.
You just need to make sure it's perfect, and you don't need to overdo
rare.
it. Medium rare. Yeah, you don't need to overdo it. Have less adverse events and have a really good good steak.
You literally allow the body to focus on actually treating it and starting that repair process, and then adding the exosomes on top of it. Oh, this is gold.
So these exosomes, I brought out the 5 billion. You're welcome. They're 5 billion exosomes, and the diluent, I poured kind of a thick little diluent into it, and we mix it up. It's just kept in the refrigerator. So we don't do PRP anymore, you guys. Just telling you.
Rarely.
We have done exosomes like pretty much continually all the time. So this being said, like we told you earlier, these little channels are seared. The little edges are seared because of the needle. Now these exosomes are going to be going into those little channels and helping to communicate to really grow your eyeball, to help enhance the collagen and elastin production and healing. Exosomes are very uninflammatory. They're de-inflammatory. We'll talk more about that later.
Yes.
But anyway, we'll talk more about exosomes later.
This is,
we love them.
The studies are going to show 600% increase in collagen production, 300% increase in elastin production. Why wouldn't you put that on something that is now able to penetrate into that level to do that? So that's why we love exosomes. Remember, PRP is inflammatory. If you've ever gotten injected with PRP, you swell. You don't swell with this. This de-inflames. It's about de-inflammation so that your body can now start the process of healing. If your body, and people go, oh, isn't that going to decrease the collagen production? No, your body does not know when to stop. You're going to inflame, and you're going to inflame to one extreme, and then the body has to control itself and go, oh, we overly inflamed ourselves to bring in the circulation, to bring in the macrophages, bring all the healing cells into the area, and then you finally start the process of healing. This can cut that time down so that you can actually start the healing process more immediately. Okay, so a little bit more, and I just sit there and I kind of rub into this area. And I tell my patients, leave it on for the rest of the night. It forms a nice barrier. The condition, the media that's the diluent has a lot of growth factors, all that stuff. We cannot tell you inject the exosomes.
No, they are not cleared for injection. That's kind of all we can say.
You as a practitioner can do what you want in your choice, but from the standpoint of the company, it is FDA. Well, you're not FDA cleared. It's cleared through the topical aspects of the FDA as far as clearance is concerned. So we are talking about this for topical usage only. How you use it in your own practice is up to you.
I think that's clear enough. So I'm having one of my staff go grab something that's brand new on the market that I like to put my exosomes on the skin with, and it's called a curator. It's a little tip that goes onto a syringe that helps to just spread it.
Oh.
So I don't have to, I can pull this up in a syringe and just put it on. I'll show you guys what, if you can see this goes onto a Lurlock syringe, and your product comes out of here.
It's
and
like
you
it's
literally,
like the overhead shower.
it's, oh, I love it. And you literally you could drop your exosomes in a little 5cc syringe, Lurlock, and you just squirt it and it just spreads it really nicely.
Oh, nice.
So it's brand new on the market. I think they're selling them now, but we get them from Airtight, and you guys are going to be the first to hear about this. So yeah, it goes onto a little, you can pull this up. I'm not going to do it right now, and then you put it onto a Lurlock. And then when you have control, you just put a little bit on and you can just smear it and you have control over it. So great idea. Why didn't we invent this? That's all I'm saying. But that's called a curicator. Anyway, just so you guys know.
Why didn't we invent a lot of things, Lori?
Right? And no, we're not getting paid for this to sell this. We're just going to tell you about stuff we like. That's all. That's how we are. Okay.
All right. So we're done with this side. So take a look. Let's.
Hey, I like your bracelets. I like.
And you can see she's already starting to decrease that redness. So in another 15 minutes, she'll be more pink. And she has a little bit more. She even says when she runs up the stairs, her neck gets really, really red.
Yeah.
So she naturally has a little bit more vascularity in her face. But probably in about half an hour, majority of it does start to soften out.
Yeah. Love it.
All right.
And usually we recommend doing a series of 3 or 4.
Yes.
Yeah. So
for sure.
So we always tell people to kind of do a series of 3 or 4 and really get that collagen going. I don't tell them to really expect a lot from one, because you always want to under promise and then over deliver. So under promise and make sure that you tell them, you're going to see it the best after 3 or 4 sessions, and then even more 3 or 6 months after that, because the collagen is going to be, and elastin is going to be forming.
All right.
So
we're going to go up and talk about exosomes.
Yes, we are.
But we'll wrap up. Go to the link that's on your chat room. If you guys are interested in the exosomes or in the Sylfirm, which I think you guys all need to have. But talk with them. There's a Zoom chat room as well. You can talk with them about pricing and stuff like that. But definitely one of my favorite machines now.
Yeah.